This is Dr. Fox. Thank you all for your continued support for CRPN and CRPN Central. For more information about our mission, please contact us today at info@crpaynet.com for details.
What a week. My practice is really picking up during this sickness season. Hey, what's going on? You seem kind of down.
Sorry, I guess I'm a little distracted. I have another patient who I can't really help, and I don't know what to do for them. The thing is, I know there's a clinical trial they are qualified for, but I don't have a way to give them access.
That always makes for a bad day. You know, I was talking to a colleague. She just joined a site management organization to help her access trials for her patients. You provide the practice and the patients, and they will bring research expertise to your office.
Yeah, I've heard about SMOs. I hear they can get pretty hairy with bad contracts, low payments, and dishonest billing. I don't know if that's a good option.
Well, there have been some bad players in the space, but there are a number of options out there with missions for all of the right reasons. Some who are even trying to give patients, just like yours, access to the trials that they need.
I guess I can't count them out completely. Will you ask your colleague if they'd connect me to their SMO to discuss? There's got to be a better way.
Site management organizations, a business model with good intentions to help so many patients in need, while demonstrating far too often everything that is wrong with this industry's greed and compromised business decisions. SMOs can offer powerful access to research in some of our communities who need it the most, as long as they do not fall into the hands of greedy and ethically compromising business owners. Sites. SMOs have their value to you, to your communities, and to our industry as long as we structure and execute them properly. Don't let their past reputations prevent you from exercising their values. However, be sure not to forget the past in an effort not to repeat it. Sponsors. There are more patients in our communities who are qualified for your trials than you know. We need only build an inclusive and welcoming environment to access the trials that may help. And with the right management at the helm, SMOs may actually be able to do it. Give the right SMOs a chance. For you, for the participants we serve, and for the generations of patients who will live happier lives because of what we do today. Welcome to CRPN Central, the official podcast of the Clinical Research Payment Network. I'm your host, Dr. Daniel Fox. CRPN Central discusses the real issues with our clinical research industry to explore and identify mutually beneficial solutions for all of our stakeholders. We live in a society of research deserts and communities who do not have access to reliable research skills, talents, and expertise. And although site management organizations have attempted to solve this challenge in the past, they are commonly known as a bad, greedy, and inappropriate business model in this industry. How can we properly operate an SMO to empower positive and inclusive clinical research in our community research deserts? Today, we will discuss site management organizations in the clinical research industry, defined as organizations that contract with investigators to supply staff, oversight, guidance, and infrastructure for compliant and efficient clinical trial performance. First, we will speak with a passionate community advocate who wants to bring research access to her Midwestern hometown. Then, we will discuss SMOs with passionate research advocates who are building a new generation of services to help serve diverse communities in need. To maintain valid comparisons, both interviews will use the same questions, and my guests did not know the questions before the interviews. We will reconvene after our interviews to compare answers and perhaps identify ways we may properly utilize SMOs in our community settings. Our first guest is an experienced professional who wants to bring research front and center in her hometown. Alisha Moore is an experienced phlebotomist, medical laboratory scientist, project manager, and data collection leader with almost 2 decades of experience across the Midwest in health and research-related careers. Now, as a subject matter expert, Alisha wants to bring research opportunities into her community to address disparities and improve health in an area otherwise excluded from access to clinical trials. Alisha is an absolute superstar in our industry, and I am so thankful she is willing to speak with us today. Please welcome with me Miss Alisha Moore. Miss Alisha Moore, how are you doing today?
I'm doing quite well. How are you?
Would you be willing to introduce yourself to the audience?
Absolutely. Of course, my name is Alisha Moore. I have a clinical laboratory science background and hospital phlebotomy background of over about 15, 17 years. And then I entered into the clinical research space in 2021 as an in-house CRA, got promoted to an associate project manager. That project was dismantled. And so right now I'm in the data verifier position, but I love being in the clinical research space and I intend on doing a lot of great things for my community.
You had mentioned that you have some dreams about your community. What are your dreams? What do you mean by that?
My dream, since I didn't know anything about the clinical research industry, was basically kind of just dropped into my lap, if you will. I notice now that my area, they do not really know anything about it. So my goal is I have a business. It's called Clinical Research Science Solutions. And I have opened up what they call an executive career coaching package. Anyone that is in the healthcare related field, nursing, medical technology, respiratory therapy, if they're looking to transition into the clinical research space, I want to help them with that. But the way my program is set up is I want to start with the basic terminology. That way they know exactly what they're getting into. Because whenever you get into this research space, I felt like I was thrown in there and you're hit with all kinds of terms and forms and phone calls. And it's like, well, I don't even know if I made the right decision. So whenever I get ready to coach my clients, I don't want them to feel so lost. And then I'm also I'm hoping to open up my own clinical research site in my area. So that requires me networking with the people at the hospital. Those are my dreams, just educating, being a pillar in my community in the clinical research space.
And that's very ambitious, and I'm glad that you're choosing to bring clinical research to your community with your own clinical research site. As far as where you live in your community, how much access do they have to research?
There's nothing here. So the nearest research site is 2.5 hours, 3 hours away. I would be the only one in my area to actually open up something that is so innovative, helpful, beneficial for the people in my community.
It's not like your community wouldn't want the research.
They need it. I know they need it. There are people with health issues and, they have to travel so far to get to the research site. So why not bring that here to the area? That way they do not have to travel far because, whenever you're taking care of your relatives, it's a lot to have to help individuals. So guess what? Now they don't have to travel so far. They don't have to worry about maybe childcare or missing work a lot just to travel so far to get to where they need to participate in a clinical trial.
I feel the same way. I call them research deserts. We have some research around here. Like you've got your hobby departments and you've got your medical school. There's some in the area, but it's like all just the rights. You have to have just the right indication. You have to be lucky enough to have just the right doctor who just so happens to be experienced in research. Way too many just the rights. And I'm the same way. 2 to 3 hours away, that's your biggest city. And if you really need help, then that's where you have to go for research. It seems so odd to me in 2024 that this is a thing.
I know. You would think by now we would have closer access to a clinical research site.
Today's topic is site management organizations, or SMOs, defined as those companies that try to bring clinical research into healthcare areas. So many different types of business models from one way to the other. Sometimes you think that it's a really good concept, but other times it seems like it's a problem. I'm going to ask you a series of questions, and I've already asked those questions to another interviewer, and we're going to take your answers to these questions and compare them to the other interviewers to see how we can utilize the concept of SMOs into a way that we can do things like bring clinical research into areas that don't have them, or maybe give access to clinical research to communities who would otherwise not have the opportunity to participate in clinical trials.
Sounds good.
Have you ever had to work or deal with SMOs?
No, I have not. I did not even know they existed until maybe a few weeks ago whenever we talked about it. It's very new topic for me.
How do you define or understand a site management organization?
From what I understand, it's almost like an overarching view of managing sites, ensuring that if they don't have the materials or the SOPs or the employees, or they don't know how to do the negotiations, the SMOs, they come in, it's almost kind of like the save the day. They are there as a backbone to help the sites get started from scratch, if you will. They're helping to build that infrastructure for the clinical research sites. They are like all in one company to help clinical research sites do well in the industry.
I think that SMOs are morphing in a way, especially with the emergence of national networks for clinical research. If you look at like the national networks, most of the time they develop like a centralized administration where they're going to have one office and they take care of all of the things that you don't need to do in the field. And then over at each site of this network, they only include what you need to do the research with the patients. You have CRCs, you have managers, and then you have some facility that actually performs the research. And I always like analogies. It almost feels like SMOs in some way are like a franchise. Let's say you go to your local restaurant, the chain restaurant that is in every single city. You still need boots on the ground. You need people to interact with the community. But the franchise themselves, they come in and they'll give you a brand, which means that brand can bring you customers. They'll issue their special food or whatever they're known for. So they provide all of this infrastructure that specializes that franchise as a franchise. In a partnership, the local community members, they provide the community relationships, they provide the boots on the ground, so to speak. They're there to serve the customers. And in theory, the two of them should be working pretty well together.
Mm-hmm. Correct.
How do you feel about that? You're sitting here in a community, you're like, okay, we're in a naive research population. What would happen if a franchise came in and said, we'd love to work with you to help you develop research in your community?
That would be a pivotal point in this community because, as I mentioned before, there's nothing like that remotely here. I think it would be a little difficult to get off the ground, if you will, because certain communities or certain towns, they're used to having certain businesses in the area. Bringing something like this in could be a bit of a challenge, but I think it will go over well once the community is able to trust what you're doing, to trust and say, hey, this is actually going to work for the benefit of X, Y, and Z.
And trust is the key. How do you think you build that trust?
Actually, I would have to establish myself as the clinical research professional and just speaking to people about what I want to bring in, just educating the people, getting your name out there, getting your business out there, and letting people know this is what I want to do. And this is the benefits of working with an SMO and bringing in clinical research to the area. And then you also have to address the concerns that could come with bringing in a clinical research site. Oh, you're using me as a guinea pig, things like that. You have to address those
Oh,
issues.
yeah. Especially in research itself, there's a lot of political polarity. I wonder if the development of that trust, that networking, that relationship with your community, it's not just like you go in there and do it once. Odds are it's a very long, drawn out, and persistent process.
I would definitely have to connect with, I call them the higher ups, and continue to keep building those relationships. I've been in this town, in this area for a long time. I think I know how the mindset would operate, but I also know how to go in and say, hey, these are the benefits, and just build from that point.
Anyone who's been in the industry, they have high concerns about SMOs. What do you think are the disadvantages or the concerns about working with an SMO in your community?
Maybe the complexity of it. If I'm working with an SMO, how many sites are they managing? How are you going to coordinate the clinical research sites if you're managing all of them? Is that going to be an issue? Is it going to be poor coordination or poor communication in between? Is the ball going to be dropped because you're managing so many sites?
Yeah. How many resources do you have versus the sites that you have? What about even the business relationship that you would have with your SMO? Oftentimes, when SMOs are introduced into a community, the SMOs will pitch what they can do to their physicians or a hospital or a local clinic. This is what we do. Here's your easy button. We'll come in and take care of everything. We'll provide the guidance, the education. You provide the feet on the ground and the patients and the attention at the community. It sounds like a win-win situation. And then things happen. The bandwidth that you were talking about, maybe the SMOs are far more of a broker than they are an SMO. Another option is how much do they take? Here's the easy button. They're going to make it so easy, but you're still doing work on the grounds, on the front lines. And then when you find out that they take 50, 60, 70, 90% of the money, gets kind of concerning after a while. Look at the breakups. When SMOs break up with sites, people at their communities, generally it'll happen because the CRO or the sponsor accidentally sends the site the budget, and then the site realizes how much money the SMO was taking the whole time.
Oh, wow. I would definitely feel like I have been undercut, blindsided. So you would have to actually find some SMO that you can negotiate with as far as the percentage, maybe 5%, 10%, 15%, whatever their policy is. And if you are okay with that as a site owner, then you can proceed with that particular SMO.
Not all sites are created equal. Some people, they've got an idea and that's it. And the SMOs may have to come in and offer almost everything, sometimes even the staffing.
Yes,
And that makes sense that they get a lot of money because they're doing a lot of work.
absolutely.
As sites continue to do more of the work, it would only make sense that sites get more money than the SMO.
Hmm.
So it has to be flexible and scalable.
At what point would the site disconnect from the SMO?
It's all in the contract. And oftentimes it's we agree to this, and then 60 days later we'll pass over whatever it might be. But going back to that franchise model, whatever the food is, most of those restaurants don't break the franchise because that's what brings in the money.
Hmm.
It could go both ways. Either a site could become so independent with itself, it has what it needs, so it can fly on its own. Then there's a cordial disconnect from the site to the SMO. Or the site really enjoys all the opportunities that the SMO brings and its convenience, and sometimes it would just opt to stick with the SMO.
So you stick with basically outsourcing. Both businesses are flowing in a fluid way.
It can be very synergistic. The site has those local community connections that you need for the patients. The SMO has the national connections that can bring the trials into the site. If you maintain a good business relationship and everyone has what they need, SMO relationships can last indefinitely.
It's awesome that it's not necessarily a definite cutoff point. You can continue on with that relationship.
What do you think are some of the advantages of working with that SMO?
Let me speak for myself as a future site owner. They would provide the infrastructure I would need to get it up and running. They would provide the knowledge where I lack to get my site up and running, and just getting all the basics to get started with a clinical research site. A lot of times you need to have the help because you can't do it on your own. I need an SMO to help get my research site up and running and up to par. And you can't do it on your own. There's no way. You have to have a team of people helping you. From my point of view, no man stands alone. I think it's a huge, huge positive.
There's 3 things that sites need that generally limits them from doing research. The first is the PI, the next is the patients, and then the third one is the trials.
Mm-hmm.
So you have to have trials coming in the door. Those are the 3 barriers that generally keep people from doing research. Either you can't find a doctor who's willing to work with you,
Mm-hmm.
you can't find the patients who are willing to be part of the trial, or you can't drum up the business. If you want to try to get into a global industry in your community, it's really, really expensive to get out there and network and find the opportunities to bring trials. There are some SMOs that provide PIs. It can get tricky. Most of the time, it's up to the community to find that relationship with that doctor.
Mm-hmm.
Same thing with the patients. That's boots on the ground. You've got to have that relationship with the patients. Odds are that's going to be the community engagement. One thing that SMOs can provide with that equation is definitely the trials. So because they have access to the entire industry of trials and they're always out there bumping elbows and being national, they can always have a stream of trials coming into the sites that they manage. The local community sites could provide the relationships that you need to be a part of a trial. SMOs can bring in that expertise, trial opportunities, specialized facilities. So when you combine the local plus what the SMO has to offer, you have some pretty synergistic advantages that you could be a part of.
For someone like myself, let's say if the SMO provides a PI, how would that work for a rural area? Would the PI be willing to travel? And you would have to look at that.
There's all kinds of ways you could do that. Odds are you won't have a PI living in your community. Generally, what will happen is they can provide PIs that could offer travel. There are telemedicine opportunities where the PIs can be a part of your community through oversight. A lot of SMOs, they'll have experienced PIs who are on board. They will bring on community physicians as sub-investigators in a form of PI grooming. A perfect example, it's a cancer consortium, because in the group, there is a PI who's in the region who has oversight to medical directors, site directors, which are MDs in all the different communities.
Oh, wow.
They already have this model in place in the cancer industry so that you can try to offer cancer research to all these different groups. Where the PI is in one state and across the entire Midwest, he has oversight and delegates to all of these different oncologists.
That is amazing. I'm learning something new.
The concept of the PI and the concept of a centralized PI that has oversight over site directors, medical directors, sub-Is, they do it in cancer all the time. And it's very possible to establish that in a route for something like an SMO model. The ultimate goal should be, however, to fight the research deserts, which means that eventually you'll get to a point where you can develop a skill set for your local community PIs so that they can help to be the ones in the research. How can we operate an SMO to bring research access to our communities in need?
I think a good way of doing that is, again, I'll use myself as an example. I have a relationship with the hospital here in town, used to work there. It's possible to have the SMO, whenever I get ready to do a proposal to the hospital, bring them in as a support system saying, hey, I'm going to pitch whatever I have to offer to the hospital, to the president, and here's the SMO that will help me execute this plan. I'm not doing it alone. I have a great support system here that's going to help me execute the plan, and that'll diminish any doubt that you may have.
That would be a really good advantage. And it almost sounds like you, as the local community member, are joining with the SMO as a single team. You're not two different teams. You may be two different businesses, but you're one team coming together into a community to accomplish something.
That's the main goal. They have what I need. There's certain things that I lack. The benefits outweigh the disadvantages.
How do you think you could accomplish clinical research in your community without an SMO?
Honestly, I don't think I could. Knowing all the groundwork, the legwork that goes into getting a research site up and running, I couldn't. If I did, it would take forever. I think it would take longer than anticipated. But with having an SMO and coming to an agreement on the contract, because they're going to be doing a lot of the legwork as well, it would be beneficial for me to network with them and bring them on board. I wouldn't be able to accomplish the goals that I want for my community, and just even opening up my clinical research site, I don't think I would be as successful.
Odds are, given everything that you would have to do, it would take years, and I mean multiple years, to build up the revenue, build up the relationships, do it all on your own, bootstrap it, whereas it would take months with an SMO.
I'm glad that they exist. You just can't do these things alone. In clinical research, you network, you have a team of people that's going to help guide you in the direction you need to go, because they've been there. They know the industry maybe better than you. There's strengths there, and there's the knowledge that's there to help empower you to get to where you need to be. So I say take advantage of the SMOs that you're comfortable with and that you can partner with and that you have a great relationship with. You have to spend money to make money.
It will cost money. And I mean, as a site owner, I remember someone once told me, so you want to start a site? Okay, don't even start without $300,000 in the bank. And then you start adding it all up and you're thinking, oh, okay, that's probably close. Bring an SMO in, odds are that number goes down.
So SMOs are cost efficient in a lot of ways.
Yeah, they can come in and bring you things that would take you literally hundreds of thousands of dollars to either procure or to develop.
Bring me the SMO.
Bring me the SMOs. So if I were to hand you the microphone right now and I said, what would you like to tell the entire industry about SMOs and our communities and how we can make them work together for really good research? What would you say?
Choose an SMO that you can build a great relationship with. Ensure that what they have to offer will benefit not just you, them too, because you're both businesses that are looking to thrive and do well. And make sure that their mission aligns with your mission. The way I'm doing right now, I'm networking with an SMO, and their mission statement really aligns with my heart's desire. Right now, we're still in the works of building relationships, finding out what's going to work and what they can do for me, and just building that trust is what really matters.
Network carefully, choose your SMOs wisely.
Correct.
Be sure that you communicate constantly with them to make sure that you are both benefiting from your relationship, and together with your community relationships and your efforts with your SMOs, knowledge, experience, national connections with trials, you can truly bring clinical trials to patients who need them so very much in your communities.
Yes, well said.
Alisha, thank you so much for coming on to CRPN Central today. I really enjoyed this conversation. I'm inspired now. I'll talk to you later.
Thank you. Thanks for having me on.
All right. I'll see you later.
Bye-bye.
Bye. Our next two guests are revolutionizing how we view SMOs in our industry. Mitch Hilbe, who you've met in a recent episode, and Dr. Hadi Dinawi are co-founders of the site management organization DiversiTrials, an organization dedicated to advancing healthcare equity by creating diverse research opportunities in diverse communities. Mitch's experience in regulatory operations, Dr. Dinawi's advocacy for inclusion as the founder of the Arab Board of Clinical Research, and their combined passions for inclusive access to clinical trials make them excellent experts in the field, and I am so thankful they are taking the time to speak with me today. Please welcome with me Mr. Mitch Hilbe and Dr. Hadi Dinawi. Dr. Hadi Dinawi, Mitch Hilbe, I swear I just saw you.
Weird, keeps happening.
Thanks so much for coming on to CRPN Central. Dr. Dinawi, would you be willing to introduce yourself to the audience?
Hi, everyone. Thank you, Mitch. Thank you, Dr. Fox. So excited to be here. My name is Dr. Dinawi. First name is Hadi. Please call me by Hadi, Hadi. I am an epidemiologist by training, and I have been in teaching, research, and involved in community outreach programs for the past 25 years in the US and internationally, more specifically in Lebanon, in the Middle East, and in Ghana, West Africa. I have been very involved in clinical trials, pharmacovigilance with the industry, and in academia as well, developing, designing, and teaching clinical trial courses. I served as a CRC with MD Anderson Cancer Center many years ago, as a CRA again with J&J. And then I served as an IRB member in the Houston metropolitan area for several years on HIV-related clinical trials. I'm very interested in diversity. It's been a passion for many, many years for many different reasons. I actually created the Arab Board for Clinical Research last year. What an esteemed group that we have.
So, Mitch, we have just introduced you in a previous podcast, not maybe a month ago. We won't go into your origin story. Is there anything else that you would like to introduce to the audience for today's topic?
Super excited to be here. We're here, the three of us, as a partnership to share our mission with our new site management organization and network that we are building. It's called DiversiTrials. We are really, really dedicated to empowering the underserved communities to actively participate in shaping the future of healthcare. We're going to be building a network of the most culturally competent and accessible clinical research sites to foster diverse representation in clinical trials.
I cannot stop my smile if you see me right now. This is in line with whatever I've been doing, like empowering underserved communities locally and globally. This is coming all together to really fulfill my long life mission and serving those minorities and having their voices heard. It's getting too exciting that I cannot contain myself.
That really resonates with me too, with having started the Clinical Research Justice League. That was the initial intent and the focus, to dig into issues of ethics and diversity, equity, inclusion in this industry. It's another form of this poetic beauty that I see, where the superheroes like yourself that I see among many others were able to actually come together, form this group to really, really make an impact and make a change.
When Mitch and Hadi came to me and said, hey, we really want to talk to you about this. We want to start this SMO called DiversiTrials. I sat here thinking, oh my gosh, it's something that's fully aligned with me. Not only someone in the disability world, the autism world, where we need to provide access to our patients who do not have the capabilities of entering clinical research as it is right now, all the way to being a father who lost a daughter who didn't have access to research because she lived in a research desert. And it wasn't because there weren't trials available. It was everything about she wasn't in the right place at the right time. We need to get rid of that right place, right time mentality here in clinical research. That is the core mission of DiversiTrials. It doesn't matter who you are. It doesn't matter where you live. It doesn't matter what you look like. If you are qualified for a clinical trial, you will have access to that trial. Today, we are going to talk about site management organizations like DiversiTrials. I know that site management organizations, they kind of have a bad rap. Honestly, there's been people who have wielded the site management organization in ways that have not necessarily been appropriate, ethical, legal, and as a result, they kind of got a bad rap. I'm going to ask you a few questions today about site management organizations, and I'm going to ask this to another individual, and we're going to compare your answers to that individual's answers. We're going to see if we can try to find an alignment in the utilization of site management organizations in a way that they can really help our communities, not necessarily hinder the industry.
Yeah, absolutely. You mentioned kind of how SMOs got a bad rap. I was on that same page. When I started in the industry, SMOs were toxic to me. I hated seeing SMOs as a CRA. It was like, okay, they're there. They're just trying to collect those signatures from PIs and really not pulling the weight that I felt they needed to be. I've conceptually had this horrible outlook on SMOs for many years, and it took a while to get over that. The more involvement I had, the longer I spent in the industry and really being able to see those true, passionate, good SMOs, how we could structure them and the benefits that they could provide, the more it kind of grew on me. I've been a little averse myself to even using the term SMO.
So what about you, Hadi?
I'm kind of in line with both of what you mentioned. It has had some bad rep. This is why the three of us come together as a powerful group to really change that mentality and actually create some kind of a footprint in this industry, because we need to move forward in trying to actually serve minorities in some ways.
How do you define or understand an SMO?
SMO is getting in, getting out, get the money, and vanish. That's how I used to think of an SMO. But now I've developed a new understanding where the three powerful people we can change the mentality and we can create a new understanding of what an SMO is in terms of serving minorities locally and globally.
What about you, Mitch?
I think I can keep it rather light. SMO to me is very simplified. The offerings can be very diverse between SMOs. It's an organization that is designed to be able to scale to various degrees how physicians and clinical research sites are managed in order to efficiently conduct clinical research trials.
I've seen all kinds of business models, and sometimes SMOs can be very local, maybe an SMO, maybe in a single city. Sometimes SMOs can be national or even global. They're huge. I always like to compare things to different business process analogies. When it comes to an SMO, sometimes it feels like they're following the same rules as almost like a clinical research franchise, where you create this brand and you allow this brand to incorporate itself into the community. We see this a lot in the food industry. You have local chains that are franchises. They are purchased and owned by local owners who run that restaurant like a national chain. You have to adhere to certain brands, certain styles. The whole idea is you're creating this kind of a national presence that can be extrapolated and taken down to the community level on the front lines. That's what SMOs do. It's almost like a clinical research franchise. You create this core of quality, and then you work with the people on the front lines to disseminate that core quality into the communities so that you can help people. I think that was the initial thought.
Yeah, I think you're absolutely correct in that. The franchise example is phenomenal. Specifically, if you think about McDonald's as a franchise, the way I see it there, what we will do with Diversa Trials is kind of that concept of how that franchise as McDonald's, they provide this core set of competencies and principles. This is your platform. This is your base. We provide this support, provide this structure and oversight. However, I know personally, if you go to McDonald's in Albuquerque, you can get Hatch green chilies on stuff, but you can't get them in Northern Kentucky. So there's that aspect that Diverse Trials is going to bring where you can get that bespoke touch, because you have to have that. You have to be able to engage in those communities. You have to be able to approach these different cultures and communities where they are and with what matters to them.
Beyond selling some kind of a personalized protocol, the business model for Diversity Trials is to actually have a hands-on at all levels, at all times, with all communities and being part of the community and empower those communities.
What do you think are the disadvantages or the concerns about working with an SMO?
That mistrust had been always part of clinical trial industry, but especially with the SMOs, with the bad rep, the issue that I see personally is that there is no community empowerment, there is no community involvement, there's no community engagement at different levels. And again, it's not one shoe fits all. We need to actually really devise personalized protocols / programs in different communities. We need to be hands-on. And historically, I don't think personally or believe that SMOs SMOs have had a hands-on experience with different communities, nationwide.
What do you think, Mitch?
Hadi has a great point with being hands-on. We can decide that we want to take percentages of our profits and reinvest them into the communities that we're working with and have that really, really good engagement where you don't see that otherwise. But in addition to that, some of those pitfalls that you see with some of the SMOs, it's really the disconnect, even just on an operational level outside of missions. If you have an SMO that's kind of just acting as like a study broker and they're trying to get studies and then they really have no idea what's going on at the site, you end up running into many, many issues sometimes and you lose communication. I've had so many interactions with SMOs and sites where I'm a CRA or I have a CRA working on site, and what we're hearing from site staff is completely different from what the conversations we're having with the SMO are. And it's like sometimes they just don't even talk to each other and weeks will go by and if there's significant updates and impactful conversations that have happened, why wasn't this disseminated? You are a contact. How was the rest of your team not aware of these major impacts?
Yeah, Mitch, you've said it really well. We're creating a business model where we allow community ownership, empowering communities and trying to empower them in a way that they can actually take ownership of the program, to partake, be proud of it.
Coming from someone who has sat through a number of SMO pitches trying to sell SMOs to the physicians, this is generally what happens. Someone will come in and they'll say, hey, we'll make research easy for you. Here's the easy button. You give us space, you give us your patients, and we will bring you trials. We'll bring you the staff. We'll put the equipment in. We'll do all this stuff. We'll make it super duper easy for you. All you have to do is sign papers and you get a bunch of free money. That has been the sales pitch. Now, let's start reading the contract. Let's look at all the fine print. So when you sign up with this SMO, these are all the things that happen. You are not allowed to negotiate with anyone else other than us. You're not allowed to bring any other trials in. You're not allowed to do anything without us present at all. We are the management organization. You can't make decisions without us. You're not allowed to talk to people for 2 years after you've left our network. Not only are they coming in and binding sites to these really, really crazy demands, but they are also taking a lot of the profit. So generally what happens is when a site chooses to leave an SMO, it's because they realize that they can make more money doing the same thing without the SMO. We don't need you anymore. We'd rather do this on our own. We don't need the management organization. And the SMO comes back saying, whoa, 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 read the contract. You're not allowed to. This is all the stuff that we own. That is a huge concern for almost every site that I've talked to where they've said no to an SMO, is they feel like they're being used by the SMO. The SMO takes the profit and they do the work. So Mitch, have you ever seen a situation like that?
Oh, absolutely. You touched on the just need your signatures here, here, here. That was one of those first experiences with SMOs that I've had. It's also why, sometimes those SIVs can be very, very boring and everybody hates having to go over the same exact language you do with every single site and every single investigator. But it's so pivotal to have those conversations and make sure, hey, you need to fully understand that you're the one who signed this 1572. You have this agreement with the FDA for conducting research. I don't care what the SMO told you. You are the one that's accountable for the conduct of this clinical trial.
That was in the FDA guidance in 2007. They shouted out to SMOs, you may sign this agreement with the SMO. They may be doing all this, but guess what? Guess whose neck is on the line? It's that investigator.
Yeah, always. And then to your point with some of those breakups, we can call them. I've been witness to actually like violent breakups where they're ripping refrigerators out of units and there's like screaming matches that were going on in the halls sometimes because someone from a sponsor accidentally sent a contract or budget to the site instead of the SMO. It's that realization sometimes where it's like, wow, we have been doing so much. We are investing so much work into running these trials. And really the site did. They branched off very successfully on their own because they could have. Some sites might not have that ability to, but they had all their own staff there. They were integrated in the office really well. Those breakups do happen. It's unfortunate.
What do you think are the advantages of an SMO?
It really depends also on the scale. And I think that's why scalable services from SMOs are so important because not everybody has the same needs. So that's where that scale comes in. As a physician, if you have flexible office space, maybe you have staffing and you're not terribly busy with your practice and you can integrate research into your facility or through your practice, that's a service where you don't know the regulatory and it is complex. There's building those relationships and having those relationships with CROs and with sponsors to be awarded trials, doing all the maintenance for a study and knowing what you need and knowing how to get through feasibility and contract and budget negotiations, that if you're a physician somewhat even naive to research, even the ones that aren't research naive, there's not a whole lot of PIs out there that are doing contract and budget negotiations. It's the same concept of having like a practice manager, schedulers for your clinic. You need a support system, and that's what SMOs can really provide and offer: a comprehensive support system and structure for you to be able to integrate clinical trials and run clinical trials at your sites.
Mitch, I love how you ended it with comprehensive support. It's A to Z, emotional, mental, spiritual support to sites. Wholeheartedly, it is a comprehensive support system that is wholesome.
I would be remiss if I didn't mention my core concepts of leadership and team building. Having that empathy is really what Hadi's touching on there too, is empathy and having fun and fostering truly healthy, good relationships is more than just your team. Those same relationships should exist. We're going to have fun. We're going to do awesome community events and involve the site. You have to have empathy at a minimum to kind of understand where communities and where even a specific site is coming from, and trying to help understand their struggles and what their challenges are, because that's how you help people.
I am smack dab in the middle of a research desert. You've got your hobby departments. There is clinical research in the area, but it's so focused on that specialist who just so happens to also be a PI, or just so happens to be that medical school. Trials are very sporadic here. You're lucky to get in a trial if you have just the right indication, just the right trial awarded, just the right trial. Way too many just the rights in the research deserts for clinical trials to happen at all. It never fails. You get calls when you are a research expert who lives in a research desert from your community. I just got this bad diagnosis. Is there anything you can do for me? Can you help me? And you look around and you say, well, you can go to 100 miles away. You can go 9 hours away. There's something. You have something 9 hours away. And what the patients are saying are exactly what the physicians are saying. I have this patient. There's literally nothing more I can do for them. I don't have access to research. I can't offer them research where I'm located. And the closest help is literally hours away. That's one of the most impactful things that an SMO can do in those small communities who cannot afford a research department because they don't do nearly as much of it. They don't have the expertise, the skills, the PIs, the talent. They don't have what it takes to run research. But between the synergy of an SMO's infrastructure and their patient population and their practice, you can bring research to the patients. They don't have to go hours away. You would have the opportunity to empower your community in diverse areas to offer research in a convenient and accessible way.
I'm not in a research desert here, but I think even beyond that, even when you do find sites, and even if sites are accessible, more often than not, they're what I've been referring to as white sites. They don't know how to engage with communities. It's like these other populations really don't even exist until they're needed. And inclusion needs to be something that is constant and all the time. Inclusion isn't an afterthought. Inclusion is never supposed to be something that just benefits you when you need to meet diversity goals or enrollment data, have your FDA compliant diversity initiatives met. It should be a constant.
Inclusion, it's not just about race. And that's what we have to actually make it clear to our communities and through our promotional material or whatever you want to call them, but it's more than just race.
How do you think we can operate SMOs to bring research access to our communities in need?
Working in tandem with our communities, community leaders, training our naive PIs on sensitivity trainings, our staff on sensitivity and cultural competence modules, working hand in hand together and trying to create some kind of a positive social change.
Hadi kind of hit the core concepts there. One thing I'm not afraid to admit is that I don't necessarily know. I don't have all the answers, and that's what we need to be able to accept and acknowledge. That's why I'm so happy to have both of you as part of the team with me. So what we need to do, like Hadi said, is really get involved with stakeholders, people who do know the communities and people who are involved constantly, and build those relationships and foster healthy understanding of research and try to help drive improvements to not just research, but healthcare equity as a whole. We need support from the communities.
And to get support from the communities, you're going to have have relationships with them. You're not going to go up to them and say, hey, do this trial with me. It's going to be, hey, do you want to form a partnership? When trials come, we will work together to do them right. It's very preventative, very proactive.
I love the word proactive. I usually constantly use proactive as a terminology with my teachings and seminars. I think this is where we need to go by.
Same. That was always one of the core concepts when teaching EMS classes, like paramedics and EMTs. You have to be proactive and not just reactive to situations. Always show up prepared.
If I were to hand you both the microphone and I asked you, what would you like to tell the entire community in research about SMOs, where you would like to see them go, and what you think they will do for our communities, what would you tell them?
Have a growth mindset, empower, give communities ownership, involve them, and change your mindset in terms of creating new models.
Maybe like don't let the past haunt what your potential could be.
Right.
What about you, Mitch?
My last words on this conversation, I think, are going to be relatively short. I have a quote that I've really come to like from John Shar. He said, "The future is not some place we are going, but one we are creating." That's what we're here to do. Everybody sees DEI in different ways. Maybe that's good, maybe that's bad, but we're not going to get there by just having these conversations. We're going to get there by actually taking action and initiatives to make the improvements that need to happen.
So diversity, equity, inclusion, they're not just buzzwords. They're relationships that we have throughout our communities. And even when our communities do not have what they need to be part of research, we have what it takes to empower them to be their best. Hadi, Mitch, thanks so much for coming on to CRPN Central. Such a powerful message. I really appreciate your time, and I look forward to sharing this with the audience.
Thank you. It's been a pleasure.
Always a pleasure.
I'll talk to you guys later.
Thank you. Bye.
All right, bye.
Bye.
Alisha has worked in phlebotomy, laboratory science, project management, and clinical research data verification for over 17 years. She has big plans to exercise her skills and expertise to become a research pillar for her community, including her services at Clinical Research Science Solutions, her advocacy, and even starting her own clinical research site to bring trials to patients in need. The concept of an SMO is a new topic for Alisha. However, she sees them as a potential backbone to bring skills, expertise, and resources into the communities who cannot easily access clinical trials. It will take time, education, awareness, and importantly, trust to properly communicate the benefits of SMO collaborations with her community, and there will be concerns to address, such as political polarity or misconceptions around clinical trials. However, they may help sites to start up in months, not years, and actively bring an industry of opportunity to their community site partners. SMO partnerships can be complex, and the community members need to be conscious of their collaborators' bandwidth. And SMO and sites alike need to develop a strong relationship that prevents feeling undercut or blindsided with unexpected compensation levels or broken trust. And if we network, choose our partners carefully, communicate transparently, and synergize our strengths as two businesses into one team, the benefits of communities and SMOs partnering together far outweigh the perceived risks. Combined, Mitch and Hadi have decades of experience in teaching, research, epidemiology, community outreach, and advocacy. With backgrounds ranging from the Arab Board of Clinical Research all the way to the Clinical Research Justice League, the team is coming together to found Trials, the community SMO dedicated to actively growing culturally competent and accessible clinical research sites in some of our most underserved minorities and communities. Historically, SMOs have had a pretty bad rap and are known to be money grab trial brokers who deliver hands-off management. Trials plans to change this, primarily by creating engaging and interactive community services to holistically care for our communities and our trial participants. And akin to franchises, a properly planned and operated SMO may house a business model capable of offering standardized quality, bespoke customization to each region's cultural needs, and an active collaboration that is tandem with our front lines to establish strong community research programs. Inclusion is not just about race. It is not simply an afterthought when we must meet trial diversity requirements, and it should always be a constant. And if we embrace empathy for our communities, promote proactive relationships, and maintain flexible services to the varying needs of our sites, we will grow the potential for strong community sites and powerful trial performance. All of today's guests agreed SMOs are intended to provide a structural and supportive backbone for its local community partners, and that working with SMOs can yield concerning but manageable risks. And while Alisha believes SMOs may provide cost-effective and rapid site startup, Mitch and Hadi emphasized the importance of empathy and community engagement for proactive relationships. So, how can we properly operate an SMO to empower positive and inclusive clinical research in our community research deserts? Alicia's perspectives in her community and Mitch's and Hadi's missions resonate three core requirements. To properly operate SMOs for optimal community impact, we must focus closely on communication, synergy, and relationships. Maintain constant and transparent business expectations between the site and the SMO. Create a healthy business relationship that leverages each of your partner's strengths. And build the local and industry-wide relationships that we need to perform strong clinical trials for our sites, our physicians, and our participants who would otherwise be denied access to the trials that may help everyone to live happier and healthier lives. Thank you for tuning into today's inspirational SMO Discovery episode. SMOs of the past may have created a bad reputation. However, don't discount the missions and the passions of new SMO generations for diversity, equity, and inclusion. If you are currently living in a research desert and feel just as passionately as we do about trial access for our communities, reach out to Hadi, Mitch, or me to learn about how Diversa Trials is building access to trials for all of our communities. Thank you to Alisha, Mitch, and Hadi for sharing their stories today. Thank you to Addison, Gumbert, and Ronak, Ganatra for volunteering as participants in today's CRP in Short. Finally, thank you to my CRP and Central sponsors for helping to make this podcast possible. Thank you again for listening, and we'll see you next time on CRP and Central.